Sex Positive is the new judgment-free sexual health app from the University of Oregon Health Center. Before entering the app, users must agree to express and obtain explicit consent from everyone involved before engaging in a sexual act. In addition, we make it clear that we will not track or share users' personal information. When the app opens up, the navigation at the top of the screen includes two spinning wheels and a sentence that says, "When my blank touches a blank." The inner wheel is the My wheel, and it includes a list of body parts. The outer wheel is the Touches a wheel, and it includes a list of body parts and other objects. A user may also manually align the wheels to create the matchup that they desire. When the wheel stops, the sentence is filled in with the options from the wheel, and the user is presented with the choice of selecting STI risks, safer sex practices, communication and advice, or spin again. If we want to know what the STI risks are, we can click the STI risk button. The matchup sentence continues on to the risk screen. The user will be presented with a list of STIs associated with that matchup. If we want to know more about HPV, we can click the HPV button. On the risk detail screen, the user is presented with 4 or 5 paragraphs describing the sexually transmitted infection in everyday language. At the bottom of that list will be a link to a trusted website for more information, like the Centers for Disease Control. In addition, the user will be presented with the option of calling the University Health Center and setting up an appointment with a clinician. When a user selects safer sex practices, they are presented with a list of not only the appropriate latex barriers to use, but also tips on communication, skin safety, and any other appropriate precautions to take. Details about latex barriers include a step-by-step list of instructions in text and in video demonstrations.
This right here is a dental dam. Just like a regular condom, you want to check the expiration date before you use it.
Communication is a key component of a safe and healthy sex life, and the most important person users need to communicate with is themselves. The University Counseling and Testing Center has created a video with some basic questions users can ask of themselves. If any of the questions make users uncomfortable, they are encouraged to reach out to close friends or to make an appointment with the Counseling and Testing Center to talk things over. Obtaining consent doesn't have to break the mood. We've provided a long list of ways to request explicit consent without having to sound like a lawyer. The Sexual Wellness Advocacy Team created a series of short videos about how to start conversations that can be awkward but need to happen. Topics include requesting latex barriers, starting the conversation, giving advice, negotiating boundaries, and more. Speaking of boundaries, a yes to one activity doesn't necessarily mean a yes to every activity. We link to Scarleteen's Yes, No, Maybe So inventory stock list, where users can consider everything from holding hands to anal sex. When a user selects Communication and Advice, they are presented with a list that includes the communication section and basic advice for anyone who wants to try the combination. The Anatomy and Physiology of Orgasm is a lecture presented by a professor in the Department of Human Physiology. This hour-long lecture draws over 400 students every year. As of September 6, 2013, a month before we launched the app, the Anatomy Basics clip has over 272,000 views. The list also includes basic advice in everyday language for anyone who wants to try the combination for the first time. Some users may want to know the sources of the information in this app. We provide an info screen with a list of our on-campus partners and outside resources.